Hello class, this is Justin Garcia. So I'm going to start off by saying what blood pressure is. Blood pressure is the force of circulating blood on the walls of the arteries. Blood pressure is measured by systolic, which means it's measured when the heart beats at its highest, and diastolic, which means it's measured when blood pressure is at its lowest. Resting heart rate. So a resting heart rate is the number of times your heart beats per minute while at rest. So a normal heart rate for ages 6 to 15 is 70 to 100 beats per minute. And for adults ages 18 and over, 60 to 100 beats per minute is normal. Second, it is important to assess your resting blood pressure so that the individual makes appropriate clinical decisions. It helps identify if a person is at risk for heart disease or a stroke. So keeping track of heart rate gives an insight of your fitness level, and it also lets us know about your heart and emotional health. So to monitor the heart rate, you place your index finger and your middle finger just below the base of the thumb, and then you feel the number of taps you feel for 10 seconds, and then you multiply that by 6, so that will let us know his heart rate per minute. Ready, set, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Stop. Okay, so I got 11. So 11 times 6, 66. So his heart rate would be 66 beats per minute. To monitor blood pressure, your client has to have both feet flat on the floor and not crossed, and rested for at least 1 minute before assessing. And then you want to squeeze, so you want to have the wrap 2 to 3 centimeters where the elbow bends on his bicep, and you want to have it secure on his bicep. So what I'm going to do, I'm going to have the dial all the way to the right and squeeze it until it hits 150, then slowly release the dial to the left, and I'm going to look out for the first thump I hear, which is systolic, and I'm also going to keep an ear out for the last one I hear, which is the diastolic. Okay, so you want to have the dial all the way to the right. Slowly release. Okay. So I got 120 over 80. So his blood pressure is 120 over 80.